You will build your careers here in Nigeria, while others may pursue further training and professionalism and service. You represent our hope for a healthier Nigeria, a stronger Africa, and a better world. We are confident that you will justify the confidence that society places. Thank you, ma'am. Places in you. Let me congratulate your parents, guardians, and families. Behind every doctor we celebrate today are years of sacrifice, encouragement, patience, and fervent prayers from you, their dear parents. This achievement belongs to you as much as it belongs to our graduates. I want to thank the Registrar of the Medical and Dental Council of Nigeria, Professor Fatima Kerry, for joining us at this occasion. Personally, you're welcome. To our distinguished guest lecturer, Professor Titus Osita Chukwanuku, we are honored by your presence and grateful that you have accepted to share your wealth of knowledge and experience with our newest members of the medical profession. And to our graduates, permit me to leave you with one final charge. Wear your title of doctor with humility. Practice your profession with integrity. Continue to learn throughout life, lifelong learning. That is what the MBBS confers on you. And never forget that every patient you meet is someone's parent, is someone's child, someone's spouse, someone's friend, someone who is very dear to someone. Treat each patient with dignity and compassion that you would wish for those closest to you. Congratulations once again. May your knowledge and compassion bring honor to your families, friends, this university, our profession, and our great nation. It is now my pleasure to formally declare the 8th induction and swearing-in ceremony of medical graduates into the medical profession open. Thank you for listening.
A huge round of applause for our Chief Host and Vice Chancellor. Very quickly, may I welcome the Provost, College of Health Sciences, University of Abuja, now Yakubu Gowon University, to give his address.
Thank you very much, Mr. MC. Our beloved Vice Chancellor, Professor Akim Fawayemi, the Deputy Vice Chancellors here present, DVC Academics, Professor Udozo, Registrar, Mr. Sambo, our librarian, our bossa, Dr. Shiva Ray, our acting librarian, all the deans here present, the deans of the 5 faculties of College of Health Sciences, the Sponsio Academica, the lecturer of the day, Professor Titus Chukwanuku, and we call her the pride of not only Medical and Dental Council of Nigeria, the pride of University of Abuja, and indeed the pride of College of Health Sciences. Our proud staff, none other than Professor Fatima Kayari, the Registrar and CEO, MDCN. All our professors here present, all our lecturers, not forgetting the Chairman of Medical and Dental Council of Association of Nigeria, Chairman of MDCAN, ably represented by Dr. Aisha Tahiru, here present. Our CMD in absentia, he made a trip and he indeed sent his apologies. The people for whom we are here, There will be brand new doctors in a matter of minutes. Our graduates, and of course, our beloved parents and guardians, those that made it possible for them to be what they are going to be today. Well-wishers of the college, ladies and gentlemen, let me also recognize in a special way the MD of Alliance Hospital, who has been our benefactor and always ever supportive, Dr. Chris Otabo, and indeed everyone here present. Good morning. So we thank God Almighty for yet another beautiful day. It is now going to be a big history that today will mark the graduation of the 8th set of the College of Health Sciences, medical doctors. And 70 of them, what a perfect number. Let's give them a round of applause. So having laid the protocols, I want to say that it is with immense joy and profound gratitude to God Almighty that I welcome each and every one of us here, especially the graduating doctors today. So our inductees, congratulations for reaching this landmark, a milestone. You have persevered through this rigorous training, and today, after getting sworn in, you'll be qualified to be beside your mentors to protect life. This occasion is also an opportunity to reflect on the remarkable progress of our beloved college through the collective support of each and every one of us. The staff, the students, and indeed the management of our great university. First, let me thank the VC, Management Council of the university, for the timely promotions and sustained enhanced staff welfare, which has no doubt boosted the staff morale. We spoke, sir, Mr. Vice Chancellor, and you listened. Thank you very much, sir. Thank you. Now, the college has made some giant steps. We have transformed our infrastructural base through rehabilitating and equipping of our college boardroom, powering and furnishing of this 500-seater auditorium, the renovation of our Faculty of Basic Clinical Sciences building, installation of solar power smart boards across the Faculty of Clinical Sciences. One of our greatest milestones has been a successful reaccreditation of this institution. The Medical and Dental Council of Nigeria found it worthy to increase our quota from carrying capacity of 75 to 200. Our faculty has grown from 3 to now 5, including faculties of dentistry and faculties of allied health sciences. The 2 new deans, please stand up for recognition. Professor Charles Anyanechi and Professor Amos Warrior. Thank you very much. Our leadership voice has been heard, given the restoration that the university management heeded to our request. Today, we have a seat at the management, and we're also part of the council to see what is happening. Let's appreciate the management. Information sharing has been unparalleled since we come into play, given the echoes of the day and echoes of the week that is released sequentially to update the college members on what is going on. We thank the Honorable Minister of Education, Dr. Maruf Alausa, the TED Fund, through the FGN Grant 4 Billion Undership Initiative that was granted us. We also thank our Minister of Health, Professor Ali Pate, for unparalleled initiative in the health sector. All the thanks are going to Mr. President through them, who had made it possible that University of Abuja is among those that are counted. So we thank Mr. President of the Federation, Bola Ahmed Tinubu, GCFR, for all the great work he has been doing and within, and we pray that he will continue to remember our university for good. Consequently, we have strengthened the college's research capacity through a successful opening of research grant endowment account in both Naira and foreign currencies. Suffice to say that Accountant General of the Federation gave us the permission to do this. That was a landmark initiative within this period. And we are calling on our researchers to domicile their research funding here, and calling on our parents and well-wishers through the endowment to please donate generously to the college. We remain committed to promoting excellence among our students. We successfully secured 100% sponsorship for the president of University of Abuja Medical Students of Association to participate in the forthcoming Medical Education African Conference in Addis Ababa. In 3 days' time, he will be heading to Addis. The president stand up for recognition. And many, many more of such initiatives are in the offing for our students so that our girls' exposition early enough. Our staff development efforts has equally yielded remarkable results. 3 members of our staff have been awarded fully funded master's scholarship in health professional education by Consortium for Medical School in Africa. And whereas 2 scholars, including one from our university, have been selected through the Gates Foundation, a mentorship program in maternal newborn child health. Also, they have also picked their ticket for this same program, and everything is fully sponsored. Furthermore, we have secured the hosting right for the African Sub-Regional Center of Excellence that will be hosting the health professional education program for entire Africa. It will be commencing first with master's program in 2027, and subsequently PhD follows. So University of Abuja has been chosen for this, for Africa. Let's clap for ourselves, please. This achievement has only been possible because of teamwork, commitment, and shared vision of excellence. As we look to the future, we remain focused on consolidating on these gains. Our priorities include deepening academic excellence, expanding international collaborations, welfare package for our staff, securing additional resources for infrastructure, promoting cutting-edge researches and innovation, and producing healthcare professionals with competency favorably disposed to global stage. To our newly inducted doctors, you are now ambassadors. Well, you still have some minutes before you become the newly inducted doctors, prospective newly inducted doctors. Please remain ambassadors of these areas before I sit, of needs that we're calling upon our beloved parents, our benefactors, our guardians to assist us in. We need more accommodation for our medical students. And PPP initiative is what will help us achieve this. So we call on men and women of goodwill to please step forward and assist us. The endowment to assist indigent students and promote excellence into our endowment account. Donations of LNG, we're looking for 5 LNG buses, one for each of the 5 faculties, that will help in conveying our students for their community services and postings, and also for easy transportation. I congratulate you once again and wish you fulfilling impactful and distinguished career in medicine. Thank you very much, and God bless us all.
Another round of applause for the Provost College of Health Sciences, University of Abuja. At this point, may I very quickly call on our guest lecturer for this event for I ask the guest lecturer to just stand. Very quickly and very briefly, our guest lecturer is Professor Titus Osita Chukwanuku. He's a hardworking, humble, and purpose-driven academician, physician, surgeon, and administrator. He has over 3 decades of medical practice, and Professor Titus Osita rose through the ranks. He has a Bachelor of Science, Bachelor of Medicine, Bachelor of Surgery. He's a fellow of the West African College of Surgeons, Plastic Surgery. He's also a fellow of the International College of Surgeons, and he has a PhD, Surgical Pathology. Professor Titus Osita has participated in several volunteer jobs, both nationally and internationally. He has several publications to his name and several contributions to book chapters, and has presented several seminars. He has won several grants both locally and internationally. He is the Editor-in-Chief, Nigerian Journal of Clinical Practice, 2021 till date. Professor Titus Osita is a member of several professional bodies, so many I would not list all of them. He has been a consultant, bones, plastic, anesthetic, and reconstructive surgery in Naut, Newi. Currently, he is the Foundation Provost, College of Medicine, Veritas University, Abuja, since 2003 till date. Ladies and gentlemen, please let's welcome our guest lecturer, Professor Titus Osita Chukwanuku.
Thank you, the Vice Chancellor, for inviting me to this occasion. I will beg to stand on the very well established protocols, but I will not fail to recognize the Registrar and CEO of the Medical and Dental Council of Nigeria, Professor Kiari. Usually when we have this kind of occasion, it's not a day for long speeches. So I'm going to even abridge my own presentation. Now, let me ask who is a medical elder. And ask, why is a medical elder usually invited at such occasions as this? He or she is a person who has practiced medicine for at least half a century without blemish. And it is the MDCN that determines who has been there without blemish or not, and she's here. So I could have been indicted if I'm not qualified to give advice to our upcoming young ones. But he has satisfied me fit to do this job. Then what is his job? It is simply to share his wealth of knowledge, to guide the upcoming ones, to enable them also practice without blemish, to practice with integrity, to practice with humility, so they can wade through the murky waters of medical practice safely. And that is why it is compulsory that you are given this as you are transiting. In the next hour or so, you will transit from an ordinary person to a medical doctor, even while still remaining an ordinary person. Now, why did I choose this topic? I'm aware, having transited some decades from the mostly analog system to now the digital age, that you are going to face some challenges. Sudden responsibilities will be imposed on you going forward. I know that at the end of today, the portal will open and you'll be admitted to serve as a house officer. And suddenly you realize that enormous responsibilities have been placed on you. It is important to give you some guide. You are also going to be facing some unexpected expectations, which you may not have planned for yourself. Use and misuse of social media has become very, very important. Before you say one thing, it has gone wide, and not just what you said, it can also be misinterpreted. We need to guide ourselves more. AI and other modern gadgets have also come into medical practice. And these have continued to shape the way we reason, the way we think, and the way we act. You must also know how to make use of these judiciously and not allow them to control you or deceive you. You may also encounter some unforeseen hostility and handicaps. What you have read in the book may not be exactly what you may see. However, I want to congratulate you, and I say congratulations. You've worked hard, you've sacrificed to get here. I can assure you that medicine is quite rewarding if you practice it well. It's a rewarding profession if you practice it well. And I know you all practice medicine well. The decisions you are going to be taking once you come in will mean a lot, whether someone who has come to you will leave or not leave. And you do not take it for granted. From what you know to what you practice, you will notice that there is some difference. At the initial stages, you are going to be jittery, but I can assure you that if you apply the advice already given by the Vice Chancellor and your Dean, and the few ones I'm going to give you, you are going to do well. Your confidence will grow as you practice. So at this stage, if you feel uncertain, don't feel depressed. Know that you have just started and you will grow. Many of us pass through those difficulties. Some of the patients may not present to you the way they appeared in the books or the way you answered them in the exams. This is when you actually appreciate that no two patients are the same. But if you apply yourself to the work and with humility, definitely you will get there. Do not hesitate to seek help from your senior colleagues, those who have been there before you. Do not think that you have all the knowledge at this stage. And do not delay seeking for help. If you call for help early, you will learn more and you save the patient. Do not be ashamed to seek for help. During your training as a medical student, you may have seen some younger doctors struggling with getting a vein in a neonate or in a patient in shock, and you'll be laughing. This one says the doctor, yet he cannot pick sample. Before the end of today, it will become your responsibility to face those difficulties. But with dedication, with humility, you will learn. You may meet some challenges in our Nigerian environment. Sometimes the machine will not be there. Sometimes the electricity will not be there. Sometimes even the most modern equipments installed can break down. And you have to go back to the traditional way of making your diagnosis. Adequate history taking and thorough physical examination remain the bedrock of medical practice all over the world. The lab is meant to help you. The equipments, they are meant to help you confirm your diagnosis or expose some of the hidden things that you may not have realized. But they are not the ones making diagnosis for you. Practicing medicine in this our resource-limited setting can be a Herculean task. But I can tell you that it is not inferior medicine. In fact, it is actually a different kind of excellence. And it is because we learn the hard way that project the Nigerian trained medical doctor all over the world. That's why we are all sought after. So do not think that asking you to go through the rigors is wasting your time or giving you more trouble. Because when you get out there, for some of you that may eventually want to migrate, you realize that you have acquired so much knowledge even at this stage that even some specialists will be wondering where you got the knowledge you are displaying. Learn to follow your superiors. Learn to clerk your patient thoroughly. Learn to examine, learn to present, and learn to say the truth at all times. When you fail to do the right thing, be humble enough to say, Chief, I'm sorry, I forgot. And in humility, usually your trainers will continue to mold you to be better. Artificial intelligence, YouTube, and the rest can give you some insight. Remember, they do not take responsibility for any mistake or any fault that you may make. Your clinical judgment is still what will guide you. So, AI, YouTube, they give you some information. They do not take them so holistically that you forget what you were taught or forget to seek help from your more experienced colleagues. They do not take responsibility. If you administer a wrong treatment, you cannot say that was what I saw on YouTube or what AI said. No. Your clinical judgment is what will save you. In this practice, sometimes the system may fail you. But that is the reality on ground. We are only humans being used by God to help to heal the sick. The Almighty still takes decisions sometimes. This should not demoralize you. You must choose honesty over false hope. Remember that difficult conversations with the patient and their relatives also form part of compassionate health care. Capitalize on the experience of those who have been there before you. Learn to value it. Medicine, indeed, is a teamwork. When you get to the ward, and that's why I chose the topic, from the classroom to the bedside, you realize that every single person in the ward is important to you. Sometimes a patient relative can even be the one that will guide you. This is not the way the other doctors have been collecting the blood. That is where they usually pick it and it becomes easy. You may be struggling. So the ones that did it before you, that's where they went to and they picked it easily, and that will help you. It may be the nurse that may guide you on how to do episiotomy or how to suture episiotomy or how to manage some difficult cases. So do not ignore anyone at all. Even the cleaner is very, very important. If it doesn't clean the place, you can sleep, or anybody can slip and fall. So every single person is important, and respect all. Do not look at the Nigerian system where collecting gifts or gratification has become the norm in many settings. You will not starve if you don't collect gratification. You will survive. And the gratification you will get will be more than the one that they will give you. Please, 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 especially when you leave this country, know the hospital's policy on gifts. In many centers outside the country, if anyone wants to give, they have sections where those donations can be given. Do not try to accept an extra penny and land yourself in trouble. You will definitely get there. Well, sometimes we're overwhelmed too by the work as doctors. Sometimes you may do all you can, and yet the patient passes on. And sometimes you get so overwhelmed by the work that you also start having your own mental challenges. Do not fail to seek help. Good 18, the modern oath has remembered the doctor as part of the team. The one I swore to never regarded the doctor as a member of the team. So now, care for yourself has also become part of what I'm going to swear to today. Do not take that lightly. And look after each other. If you see your colleagues struggling, do offer help. The patient and the system has entrusted life into your care. Do not joke with it. Professionalism starts today. And if you start today, it will become part of you. If you don't start today, it will never become part of you. Protect yourself through good practice. The watchdog is there, watching every step. And I can say with some level of humility and pride that the medical profession still remains one of the most regulated professions. Our mama is smiling, but if you enter trouble, it will not be, this smile will mean a different type of smile. But we do not expect you to enter trouble. That is why we are giving you the pieces of advice today. You must hold onto the curiosity and honesty. Both the provost and the vice chancellor have talked about continuous learning. In fact, your learning now starts. Once you get to the bedside today, you will discover that this is when your own learning starts. And do not miss any opportunity at all that has presented to you. Any patient that comes to you, whether you are doing medicine posting and they send a surgical patient to you, that patient has said, learn something from me. Do not say no. you don't belong here. Take your time, clerk the patient, examine, present. You walked in this morning as students. I can tell you, and I can tell you again that you are going to walk out as medical doctors. Thank you, and thank you again.
Thank you very much, our guest lecturer. Please, a huge round of applause to our guest lecturer as he takes his seat. Very quickly, may I recognize in our midst a pioneer staff of this college, a former provost of this College of Health Sciences, and currently the Deputy Vice Chancellor, Margaret Lawrence University, Professor S.A. Atsala. You are welcome, sir. May I also very quickly recognize in our midst the Director General of Ajaokuta Steel Company in our midst, Professor Nasiru Naim. Thank you very much. He is one of the trainers of these students. Very quickly, please join me as I invite the Dean of the Faculty of Clinical Sciences to present the graduates.
Thank you, the Master of Ceremony. I, Professor Chinda John Yola. Please, before then, I will want to seek the permission of the Vice Chancellor for all the students, all the graduates to rise on their feet. Please, all the graduates, may you rise on your feet. I, Professor Chinda John Yola, the Dean of Faculty of Clinical